I want to get into a section that we do each week on TR with Dr. G called Myths versus Facts. And I love doing this section because it's really about setting the record straight. We've been trying to set the record straight already this evening, even though my camera's gone out a couple times, but that's all right. We're still with us. But I want to set the record straight on myths versus facts. So how it's going to work is I'm going to say a statement, and then my panelist is going to say myth or fact, and we're going to kind of go boom, 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 boom. So we're going to try to keep it short. I'm going to get through as many of these as we can. I've got some questions that people have been asking online, and I want to try to add this to myth versus fact too. So here we go. Dr. Cheng, here's the first statement for you. Myth or fact? Okay. Here's a statement. Until we know how many cases there have been, it is impossible to be certain of the death rate of COVID-19. Myth or fact? Fact. Please explain.
Well, so in theory, we know the top number, right? The case fatality rate is the number of people who die of COVID-19 on top, and the bottom of that fraction is all the people with COVID-19. Well, as everyone knows by now, we're not testing nearly as widely as we should, and tests are not as readily available. So that bottom number, the number of people with COVID-19, is not as accurate as we need it to be. And until we have a better handle on that bottom number, we're not going to have a very accurate case fatality rate.
Wonderful. Thank you. Here we go. Dr. Pinsky, here's a statement. Myth or fact? Here's a statement. It is not clear to what extent children help spread the virus. Myth or fact?
I would say that's true. We don't know the answer to that because children aren't tested, and we don't know. And there's all this talk about asymptomatic spread, which is an unknown area too. So yeah, that remains to be determined.
Wonderful. Here we go. Hey, I'm going to participate. Here we go. I'll take this one.
I do want to say one thing about that.
Oh yeah, please go ahead, Dr. Pinsky. Go ahead.
Closing schools. So that was a brilliant thing to close schools, because we know children are like a cesspool of viruses. We know that because they're huddled together. We know that influenza transmits very quickly in schools, and children just transmit viruses. So schools are closed now, so they're probably not a big component now. But during normal circumstances, children drive viral spread during most normal times.
Thank you, Dr. Pinsky. We definitely got to make sure that there's still social distancing, because I've seen too many play dates still at the same time, which makes me want to shake my head. Here we go. I'll take this one. I got an easy one. I'll give myself the easy one. Here's a statement. Soon, I will be able to get testing to see if I'm currently infected with COVID-19, even if I do not exhibit any symptoms. So right now, I'll say I'll say maybe fact, but an asterisk next to it. We don't have universal testing right now at this point. Ideally, yes, in a very utopian world, we would all know our status on this virus, or whether or not we're susceptible or whether or not we had it. But the reality is we just don't have the testing capability right now. Hopefully, as Dr. Cheng said earlier in the program, that we may be weeks away from having more testing, maybe even more widespread. Again, you can't manage what you can't measure. Here's a statement. Here we go, Dr. Cheng. Here's a statement. There have been 1.2 million confirmed cases of COVID-19 as of April 5th. There's a lot more now. But as of April 5th, there have been 1.2 million confirmed cases. But this is only a fraction of the total number of infections. Myth or fact?
Fact.
Please
I think
explain.
once again, because testing has not been widely available, that we're looking at the tip of the iceberg, right? We're looking at all those individuals who are either sick enough to ask their doctor for a test, or have actually gone to the hospital, or we're doing contact tracing. It's all the people that they have told us that they have had contact with. I think there's a good swath of the population that had community contact that we will never know until we have antibody testing.
Wonderful. Thank you, Dr. Cheng. Here we go, Dr. Pinsky. Here's a statement. There will be fewer cases of COVID-19 in the summer. Myth or fact? Do we know?
I would say I don't know. That depends on the social distancing theory. So yeah, we don't know. I mean, compared to influenza, influenza does spread more during winter because the virus survives better in a cold environment and in a dry environment. But if you have a population that's not immune, all bets are off. It's still going to spread fast. So I think it depends on how many people are infected. If still the majority of people are not infected, then it's still going to spread fast regardless of the season.
All right, wonderful. Here we go. Here's the next thing. Thank you, Dr. Pinsky. Dr. Cheng, here we go. Do a couple more of these. Here's the statement. Social distancing and shelter-in-place measures will end by June. Myth or fact? Crystal ball, by the way.
Crystal ball. Okay, so guys, here are the lottery numbers for today. I think everyone's anxious, right? I think everyone wants to get back to normal, and I certainly understand that. I think with the shelter-in-place orders that several governors have put into place, we're going to see that curve flatten, right? We're going to see the number of cases start to stabilize and hopefully very soon start to decrease. As Dr. Pinsky said, one of the primary goals of shelter-in-place is to make sure that the number of moderate to severe cases that need hospitalizations stay below the capacity of hospitals, right? We want to make sure that there's a hospital bed and there's medical personnel for everyone who needs it. After that, so I think, not to get too excited, but after that, as we start seeing cases go down, if we were then to lift shelter in place and we were then to reverse social distancing, it comes back, right? We still don't have built-in immunity. We don't have a vaccine. No one has seen this virus before. None of our immune systems have, any idea what to do with this, potentially except the people who've recovered, which isn't a big enough fraction of the United States yet. And I think the ability to lift social distancing and shelter in place before we get to the point where, we're fairly certain the entire curve is basically, gone and done would be incredibly foolish. I think we'd be asking for a second wave to come immediately behind that first wave.
Got it. Thank you, Dr. Cheng. We'll give you the last one. Here's the last one, Dr. Pinsky. Here's a statement. We don't know why around 20% of people infected with COVID-19 go on to develop more severe disease. Myth or fact?
We know something about it. This is ongoing research, but we do know the risk factors for severe disease. Older age, comorbid medical problems. But the strange things that we're seeing is that we see people who are in younger age groups, like in their 30s or 40s, having severe infections, even though the mortality is higher in the older age groups. But it looks like the reason has to do with that the interleukin surge. So it's the inflammatory response to the infection that kind of drives the severity.
Wonderful. Thank you, Dr. Pinsky. So there you guys have myth versus facts.